I'm called Ndeloh Esther, and you are listening to Cameroon Link. You are listening to Cameroon Link Radio. We are going to continue with mothers living with HIV/AIDS, and on this step we are going to talk about the scope and the purpose. That is, the scope and the purpose why they need to breastfeed their children even as HIV mothers. The overall purpose of this guideline is to improve the HIV-free survival of HIV-exposed infants by providing guidelines on appropriate infant feeding practices and the use of ARV drugs for mothers living with HIV, and by updating the World Health Organization related tools and training materials. The guideline addresses 4 aspects of infant feeding in the context of HIV. The duration of breastfeeding by mothers living with HIV. The intervention to support infant feeding practices by mothers living with HIV. What to advise when mothers living with HIV do not exclusively breastfeed, and what to advise when mothers living with HIV do not plan to breastfeed for 12 months. The guideline informs national policy makers in health ministries and local programs managers on what may be related for national policies and programs, including health workers training. It provides guidance to health care providers, researchers, and clinicians involved in managing pregnant women and mothers living with HIV at various levels of health care. It updates development partners that may be providing financial and technical support for maternal, newborn, and child health programs. It will also inform revisions to current World Health Organization training and reference materials, including Integrated Management of Childhood Illness, World Health Organization 2016A, Infant and Young Children Feeding Counseling, and integrated course, WHO and UNICEF 2006, Essential Newborn Care Course, WHO 2010A, Pregnancy, Childbirth, Postpartum and Newborn Care, a Guide for Essential Practice, WHO, and 2015, and a training course for community health workers caring for newborns and child in the community, World Health Organization 2015. This guideline requires appropriately training and developing the capacity of healthcare workers to supply them with the necessary skills and job aids, and provide adequate supervision and oversight. Systematic monitoring of the program will be needed for ensuring success and for identifying and documenting challenges to implementation, which is the scope and the purpose. Number 5. You are listening to Cameroon Link Radio by Ndeloh Esther, assisted by Njanking Achenyi Fontaine. Thanks for your gesture.